excuse me. Any water, maybe? There was a congresswoman in the United States who was shot in the head. Gabrielle Giffords, a couple years ago. And I remember reading the news articles, and of course it's a tragic thing. But the general gist of the news articles was that, wow, she's getting great care. The ambulance got her to the hospital, and she was in the operating room in 30 minutes, which was good. And they had world-famous trauma surgeons from the Army coming to operate on her because she literally was shot with a bullet in the head and debriding the bullet. And she was doing great. And everyone at the hospital says that she was doing terrific. And all of this was true. I mean, she was doing terrific for somebody who was shot in the head. But what they didn't say was that doing terrific in this case means probably surviving with significant deficits, and that she's going to have to resign, that it's likely that her family will collapse, that this is going to result in hundreds of thousands of dollars of expenses, and that her life has been destroyed. And that didn't show up in the news article. So I talked about my experiences with treating people with head injury. So sometimes what you read in the news doesn't really give the big picture. For example, just the other day, I don't know if you read about the epidemic, the rash in Pangasinan. Any of you read about that?
Yeah.
Right, so as soon as I read that, I said, oh, this is a classic case of total nonsense, right? That eventually somebody will actually come up and say, yes, this is some sort of rare disorder that this person has, and it's well described. It just, the local guys can't figure it out, and it's really nothing special. And sure enough, this morning, there was an article to that effect that they found a dermatologist. It was called pyoderma, something or other, and there's absolutely nothing at all exceptional about that. But if you read the news, you think the world is coming to an end. And, so that's the kind of thing I write in my essays. Well, I see a news article. There was a young woman, a newscaster, Serene Branson, who was giving the news live, just like I'm talking to you, and all of a sudden, she was dysphasic. She could not pronounce the words clearly. She was using neologisms, you know, words that don't make any sense. And this is on YouTube. You can look up Serene Branson, and you'll see for about 20 seconds, she's just coming up with words that you've never heard before. And you can tell that she's not happy about it, but she can't say the words. So it's like, well, what was that? And of course, then they cut it and went to something else. But what happened to her? So I thought she had a TIA. It looked like she was having a stroke. And I found out later that these symptoms had gone away, and they sent her home in Los Angeles. Well, that's not the right thing to do. She should have gone to the hospital. Young women can have TIA from vertebral artery dissection, inflammatory disease, all kinds of things that could have led to stroke. So I wrote about that. Number one, it's a great example of dysphagia. You know, if you learn about that in class, here you can see someone having it. So it turned out later that her mother has migraine, and that her mother has actually had similar episodes.